Did you know that as we age, our bodies go through remarkable changes that we don't always talk about? Especially when it comes to something as natural and personal as self-care? If you've ever wondered about how habits like masturbation might impact your health as you grow older, you're not alone. These are questions that many people have, but few feel comfortable asking out loud. And that's okay. Today, we're diving into a topic that's both deeply personal and incredibly important. What happens when older adults masturbate? We'll explore this from a medical perspective, unpacking the physical, emotional, and even social aspects of this practice. This video is about breaking the stigma, answering your questions, and helping you feel confident about your health and well-being. Now, this isn't about shock value or sensationalism. This is about facts, science, and a better understanding of our bodies and minds as we age. Whether you're here out of curiosity or because you have concerns, know that this is a safe space for learning and growth. So, what can you expect in the next 40 minutes? We'll start by looking at the history and social context of this topic to understand why it's often so taboo. Then, we'll delve into the physiological and psychological impacts, debunk some common myths, and provide practical advice for maintaining your sexual health. By the end of this video, you'll not only have answers, but also a sense of empowerment and clarity. Stick around, because what you're about to learn could change the way you think about your health and well-being. Let's start this journey together. To truly understand why the topic of masturbation, especially among older adults, is often seen as taboo, we need to take a step back and explore its historical and social context. Throughout history, masturbation has been a subject of fascination, fear, and misinformation. In ancient cultures, practices surrounding sexuality were often tied to religious or spiritual beliefs. For example, some ancient societies viewed sexual expression, including self-pleasure, as a natural part of life, while others imposed strict moral codes that labeled it as sinful or harmful. Fast forward to the 18th and 19th centuries, and you'll find that these views took a darker turn. During this period, masturbation was often demonized in medical literature. Doctors and moralists of the time claimed it led to physical and mental illnesses, a belief that fueled stigma and shame for generations. Thankfully, as science advanced in the 20th century, many of these myths were debunked. Studies began to show that masturbation is a normal and healthy part of human sexuality. Despite this progress, the lingering effects of past stigmas still influence how society views the topic, particularly for older adults. It's also important to note that attitudes toward aging and sexuality vary widely across cultures. In some societies, older adults are celebrated for their wisdom and encouraged to embrace all aspects of life, including their sexual health. In others, they are unfairly desexualized and discouraged from exploring or discussing these topics. So, why does this matter? Understanding the historical and social context helps us see that the shame or discomfort many people feel isn't inherent. It's learned. And if it's learned, it can be unlearned. By breaking down these barriers, we create space for open, honest conversations that empower people of all ages to take charge of their health and happiness. With this historical backdrop in mind, let's move forward and explore the physiological insights that science has uncovered about the benefits of masturbation for older adults. As we age, our bodies undergo numerous changes: hormonal shifts, reduced muscle tone, changes in blood circulation, and even differences in how we experience pleasure. These changes are natural, but they can impact sexual health and function. Fortunately, masturbation plays a vital role in addressing some of these shifts. First, let's talk about circulation. Sexual activity, including masturbation, increases blood flow throughout the body. This improved circulation promotes cardiovascular health, enhances tissue oxygenation, and even supports the body's ability to repair itself. For older adults, maintaining healthy blood flow is crucial for overall well-being. Another key benefit is hormonal regulation. Masturbation stimulates the release of hormones like oxytocin and endorphins, often referred to as the feel-good hormones. These chemicals help reduce stress, improve mood, and even aid in better sleep. For older adults who might face stressors such as loneliness or physical discomfort, this can be especially beneficial. Did you know that masturbation can strengthen your pelvic floor muscles? These muscles play a critical role in bladder control and sexual function. Regular stimulation and muscle engagement during masturbation can help maintain tone and prevent issues like incontinence, which become more common with age. One of the most significant physiological benefits of masturbation is its impact on sexual function. By maintaining regular sexual activity, older adults can keep their bodies responsive to sexual stimuli. This can boost confidence, enhance libido, and make other forms of intimacy more enjoyable. Interestingly, masturbation can also act as a natural pain reliever. The release of endorphins during climax has been shown to reduce chronic pain, whether it's joint discomfort, headaches, or other aches that often accompany aging. Of course, it's essential to acknowledge potential concerns. For those with pre-existing conditions such as cardiovascular issues, it's always a good idea to consult a healthcare provider. But for most people, masturbation is a safe and beneficial practice that contributes to overall health. Now that we've explored the physiological benefits, let's turn our attention to the psychological and emotional impacts of masturbation for older adults. Sexual health isn't just about the body, it's deeply connected to the mind. For many older adults, masturbation can be a powerful tool for maintaining mental and emotional balance. Let's unpack how this works. One of the most immediate psychological benefits of masturbation is its ability to reduce stress. When you engage in this practice, your body releases a flood of hormones like dopamine and oxytocin, which naturally help to lower cortisol levels, the hormone associated with stress. This relaxation effect can be particularly valuable for older adults navigating the challenges of retirement, health concerns, or caregiving responsibilities. Masturbation can also serve as an effective mood booster. The release of endorphins during sexual activity can help reduce feelings of anxiety and depression. For those who might be living alone or feeling isolated, this can be an essential form of self-care, reminding them of their capacity for pleasure and connection, even with themselves. As we age, it's not uncommon to struggle with body image or feelings of inadequacy. Masturbation offers a way to reconnect with your body, appreciate its capabilities, and build self-confidence. This practice can foster a sense of body positivity, helping you to feel more comfortable in your own skin. Life transitions, such as retirement, the loss of a partner, or becoming an empty nester, can be emotionally taxing. Masturbation can serve as a form of grounding, offering a consistent and private way to process emotions and maintain a sense of control and intimacy during these changes. Interestingly, masturbation can also be an exercise in mindfulness. By focusing on the sensations and emotions of the moment, it encourages presence and a deeper connection with oneself. This can have a ripple effect on mental clarity and overall emotional resilience.